going on? One of the most common questions probably any provider will get is, why did I get hurt? What's the cause? Why did I get hurt? And what I personally see is people try and break it down into something that's very black and white. They like to pinpoint one thing as to why they got hurt. Shoes, for example. It's a very tangible thing. That's the cause of why I got hurt. It's usually not that simple though. It's usually, in my opinion, the wrong ingredients for long enough to flare up a given injury. Your body's always changing, right? You're either adapting to become quicker, faster, more athletic, or you're breaking yourself down, pushing yourself down towards a potential injury. So I like to try and make it as tangible as possible. Primary, secondary, tertiary factors that may have caused a given injury. So recently, these are some examples of things that I've written down that I feel like have led to an individual's injury. For example, training error, especially with runners, building up too soon over the span of 4 to 8 weeks can flare up an injury. Too much too soon, pretty straightforward. I had an individual who had increased work during the holidays. They were driving much more often, and I feel like that may have been the thing that flared up the knee that he was dealing with, for example. So recent secondary factors that I feel like have led to injuries: lateral hip capacity, calf capacity, or prior injuries. So if you've dealt with an injury in the past, you're more likely in the future to get it. It's often the case with a lot of injuries. Prior injury is a risk factor, and biggest risk factor for future injury. Or maybe there's a manufacturing defect in the shoe that does place an abnormal stress in one of those shoes, on one of your feet, that might have caused an injury. Ankle dorsiflexion, first toe mobility, midfoot mobility, or maybe even chronicity. So how long have you dealt with the injury? If you dealt with something for a long time, the longer you have it, the harder it tends to be to resolve. So these are fluid, depending on the individual, what they're dealing with, where they're coming from, where they want to go, the demands of the sport that they're trying to get back to. These are fluid. Sometimes a given impairment is what I call it, is a tertiary factor. Other times it's a primary factor that is probably one of the things that you want to work on going forward. So these factors that may have caused an injury turn into the treatment and ultimately help get individuals back to doing whatever they want to do. So it's just context and dosage. Oftentimes the thing that caused, or a large factor that caused the injury, is the thing that can help you get better. Take running, for example, a training error. If you do too much too soon, that can flare up an injury. You dial that back enough, that's the primary intervention that can keep you active and help you resolve as you build back up intelligently. So just something to consider. It's rarely one thing. It's rarely that black and white. It's usually a recipe of things that leads you to a given injury over time. And likewise, there's often a number of different levers that you can do to help yourself get better while remaining active and hopefully not getting hurt again.